Kathy, many leading scholars believe that understanding and applying trends is one of the most important drivers of strategic thinking. Prior to the pandemic, there were so many trends in the world, it was kind of hard and difficult to select which ones were most salient.
Mhm.
But the pandemic has really accelerated certain trends, making certain ones more salient and obvious today. Would you mind talking to some of those trends that are most important to consider when strategically thinking about supply chain management from a global perspective?
Well, absolutely. And Dean Waller, thank you for having me here today. It's wonderful to see you again, albeit not in person, given the crazy world we're in now. But it's great to get to share a few thoughts about our experience here at Johnson and Johnson during these key times, and indeed that impact as we think strategically about supply chains. Clearly, supply chains have become not only the drivers of end-to-end collaboration with suppliers and manufacturers and distributors, but even across a bigger societal ecosystem. If you think of policymakers, politicians, the world community, and how it thinks of and has begun to understand, supply chains at a global level due to the pandemic. And so when we work across the ecosystem in a world that changes so much, we all have a responsibility from a trend view to not only continue to strengthen our operations in our supply chains, whether that's implementing advanced technologies, whether that's driving efficiencies, but ultimately we also have to begin driving much better connectivity and integration across the whole ecosystem. So as I reflected on, key trends impacting global supply chains at large, things that we're likely there and we're there, but the pandemic has even further accelerated. One I would say is new channels for access. We can talk about that a bit today. New levels of speed and agility, but coupled with a resilience and how those work together. Personalization, and every one of us wanting not only perhaps personalized products, but personalization of I want my box on my porch at this time, XYZ. Transparency and social impact of what supply chains do, not only the what we do, how we work. And the last one, of course, is digital, which just permeates absolutely everything.
Well, delivery of goods and services throughout the global supply chains were reconfigured at a record speed as a result of the pandemic. No one would have ever expected it was even
Mhm.
possible. Would you mind sharing some of your observations about this reconfiguration?
Well, certainly throughout the pandemic, as rolling shutdowns began, just a little more than a year ago, and businesses around the world closed their doors, borders were closed. In our industry of healthcare, hospital systems were overwhelmed and had to stop all non-critical, non-essential care. And so, in light of this, we saw a huge uptick as we moved through the year in what I call new channels for access. More, whether it's more direct to consumer, whether it's more outpatient in the healthcare field. In established markets, we had many examples across Johnson and Johnson. Certainly in our consumer health business, we saw the importance of our healthcare products, of Listerine, of many brands that allowed us to keep our hands clean, keep germs in control. Early in the pandemic, we saw e-commerce move to a level that I think we thought might have taken a few more years to get to, that just made a jump that we know there's no going back from around the globe, and how every one of us as a consumer shops. If you look at channels like groceries and how they've seen that change. Even in our some of our medical device business, contact lenses, our AccuView line, in many countries, we saw hundreds of percent increase in the desire for, and therefore our need to deliver direct to customers, direct to consumer homes, and even in some countries, medicines directly from us, where pharmacies, were overwhelmed with other things, how we could work with governments to create new channels of access. And then as hospital systems began to come out of the first wave, we understood the impact that hospital systems having stopped other non-essential surgeries had. So from there, hospital systems realized they were going to need to work in different ways. So the move from having, for example, a knee replacement surgery be something where you come into the hospital, you stay overnight, one night, maybe two, depending on your situation. Today, a huge shift to those being done in an outpatient setting. So you're not even taking any of those precious hospital resources. And we see that at many kinds of surgery. The difference, though, is hospital systems generally are larger scale buildings. They have supply chain processes well evolved. They have space for the inventory they desire. You move to an outpatient clinic, and suddenly you're talking about a supply chain of things that really has to be just in time because they don't have space in an ambulatory surgery center, for example, for things that you might have done just weeks before in a hospital setting. So how our supply chain works with our commercial organization, with our customers, to capitalize on those shifts is really key. And then there are things that I'd say were pilots, but now are really beginning to become ways of working. And when we think about the importance of reaching more patients around the world, one of the areas when we talk about new channels for access is in Uganda. So in the Kalangala region, for example, a huge Lake District region, but also has one of the highest populations of HIV patients. We're actually now delivering by drone directly to that patient's home at a time and specific GPS location where they can pick up the goods versus them being brought by boat on very rare trips. So that's something we were really proud to be recognized by the Access to Medicines Index just in the last couple of weeks for being more than a decade one of the top 3 companies advancing access to medicines and technologies in low and middle income countries. But in reality, that channel of access is changing how we drive growth in J&J by what our supply chain can do.
That is so impressive. In commercial air transportation, about a third of the revenue to carriers comes from freight in the belly of the plane. So the pandemic resulted in many planes being grounded because of lack of passenger air demand. And so that wound up reducing air freight capacity globally in a way that no one really could have anticipated. How do you think about it, especially from a risk management perspective?
Well, from risk, I'd say we've evolved our view that risk is no longer one isolated event, nor is how you manage risk. It's not one event with one commensurate action. It's how one risk can emerge and create a cascade of risks that you have to be agile to, you have to be able to respond to, but you have to be able to do that under an underlying level of foundational capabilities and resilience that you cannot build when that risk emerges. You have to have that ready to go. So if I take your example, when more than 80% of commercial air traffic was halted as borders were closed and modes changed. I think what no government, no one necessarily realized is that 70% of all medicines transported around the globe happen in commercial air travel, in the belly of a commercial plane. So when you think, though, about the criticality of a cancer patient getting their cancer medicine, no matter where it's made and where they are, we had to be incredibly agile as global air freight shifted in spurts, as we worked with governments around the world to keep the flow of goods going, and most importantly, the flow of essential healthcare goods. Sometimes it was almost like we were talking against each other. On one hand, governments were working to help airlines stay in business, but on the other hand, we needed to really shift the conversation to make sure they knew it wasn't only to keep the airlines in business, for the businesses themselves and for the amazing employees they have, but that's how medicines move. And so it was great as those conversations became much clearer. It unlocked ability for us to work differently. We certainly also had to rely on digital tools and as what I call us building out our digital thread for healthcare, to have digital visibility. And if we didn't have a good amount of that capability before the pandemic, I can tell you we would have really struggled. But with digital visibility, with things like track and trace, in the simplest form, sensors on certain pallets or with certain products, we could literally watch, around the world, not only where was something, was it on a plane? We had, I remember weeks and weeks last spring where every day, we'd be talking with the team about, we had to try to get 3 ways to get this medicine to this part of the world because the odds were 2 of those ways would get canceled at the last minute. Not only on airlines, but also I'll tell you ports. As ports became congested because people weren't able to be there to work, we saw, we have goods on ships that we move also around the globe with the global supply chain. And many, many times we had a ship that was supposed to go to port X, let's say in the Netherlands or else, and boom, 2 hours before, port's closed. Goods are on the ship. Where do we want our stuff to go? Well, we can't plop it off the ship. So we've got to find out where that ship was rerouted to. How do we get our goods and how do we get them, back to where they need to be? So all of that without digital would have been impossible. And with digital, we could make those decisions in as close to real time. And we could, in many cases, let's be the first one to book that alternative route while others might have still been scrambling, which at the end of the day, for us helped assure we could meet what we needed to do for our patients and consumers around the world.
COVID really made supply chain management, the importance of it from a strategic perspective, really shine. But the pandemic also caused a change in the types of
Mm-hmm.
and quantities of products demanded in many industries, especially in the medical devices industry. And I've heard stories about how J&J was agile enough to quickly pivot and make ventilator expansion splitters. It was a really impressive story I read about it. And would you mind speaking to that just a little bit?
It's a very special story, and I think one of the amazing stories that come from how organizations work together across boundaries and worked with that true focus of the patient need, the healthcare system need in mind. So at Johnson and Johnson, we're known for our consumer health business. We have a very substantial, very specialized medicines business, but we're also the world's most broadly based medical device business. But within that, we do not make ventilators. We do not make PPE. But due to likely a part of our ESG efforts, where at the very beginning of the pandemic, we donated an important part of some of our strategic stockpile of PPE to the city of Wuhan, because we knew if we could help contain the virus in Wuhan, we might contain or lengthen the amount of time before it spread. So I say this, that's not a splitter, but what happened from that, and it took us a few weeks, frankly, to realize what was going on is my office, our chairman, our company began to get calls and calls within days about, can J&J, how do we order your PPE? Or you make medical devices, how do we order your ventilators? And, after spending, way too much time having to explain we don't make those things, we did 2 things. One is we really became a connector. And so we had built out a PPE sourcing network with quality checks and a variety of things. So we became someone that would help connect a hospital system who was running out of PPE to a reliable supplier we'd found in XYZ location. Second, on the ventilator, ventilator asks, we challenge ourselves. Could we get in that and do that soon? And we said, no, there's so many great companies who are ventilator makers or could, but what could we do to really make a difference in what was most critical? And at the time, we understood that one of our customers, Prisma Healthcare System in the Carolinas, had actually been working for a few weeks on a design as part of their risk management program that in the worst case, if they were to truly run out of ventilators, how could you design literally a Y piece, a splitter, where you could have two patients on one ventilator. And so, in an incredible collaboration with them, and in a speed, frankly, that may even be faster than what it takes me to tell the story, with their clinical work that they did, coming together with our technical knowledge and our supply base, ourselves and our suppliers of 3D printing, our medical safety teams who got with Prisma and helped understand the safety assessment, how this product could be used, working with FDA to have an emergency use authorization by Prisma for this. In a matter of 10 days, we went from an idea to having 3D printed ventilator splitters available. And so we built thousands of those in cooperation with projections from the government. The wonderful news is because the ventilator business itself and all the other companies who chipped in and volunteered, our country squeaked through that. But there was a very real risk there that we could have had to use this last resort, right, to have to keep two people on ventilators until a second ventilator would be available. So it's just an amazing example. It wasn't that we bypassed functions that should be involved in product development or bypassed their approvals. No, we got the same functional expertise, the same global leadership. We had the top hospital systems in the country working together on this, and we're able to deliver something that truly could make an impact at the level that we really look to do every day.
That example, your example of Wuhan, and many other things I've read speak to your innovative application of supply chain management within the realm of ESG, which is a really hot topic right now in
Yeah.
business in general. But I want to ask you one last question. I'd like to ask more about that, but you've got some really good material out there online I've seen.
Mm-hmm.
I'd like to ask you about, the pandemic has really sped up
Mm-hmm.
digitization. And you alluded to that earlier, but and I'm sure you've experienced that. But could you give some examples of how you've experienced that?
Sure. So there's no doubt that first I'd say the intersection of science today, being a 135-year-old science-based company, and technology, in particular digital, the intersection of those two things allows us to invent products like the splitter we just talked about, like robotic surgery elements we're working on, like working on a vaccine in a different way. It allows us to unlock new products, new ways of bringing them to life in supply chains, digital technologies like 3D printing, but also the ability of data science and analytics to help us, for example, target and identify best populations to work on to use for clinical trials and to approach for clinical trials. Better ways as in transportation to have agility and flexibility, but to have transparency and traceability across our end-to-end supply chain to know what is where and how it was made and by whom and in what situation. So whether it's inside our plants, or even whether it's how we communicated with customers and our suppliers through different channels. There's no doubt digital is transforming everything and anything. I also say it's transforming how every one of us does our job, whether it is one of our mechanics working on third shift in one of our distribution centers or plants, or my role as a chief supply chain officer. It truly transforms everything. And so our goal is to understand from a strategic view, where does digital allow us to just do things in very different ways, work with customers' data sets, the data sets of hospitals, to create a touchless supply chain where we could bring into the operating room only the things that are needed for that personalized patient experience, whether it's on-shelf data with our retail partners to really do the pull signal through the supply chain, not just sale point of sale data, but real on shelf data to help all of us grow, or whether it's working in underdeveloped countries or regions and how digital can help us get access. So I actually changed my organization structure at the very beginning of this year to reflect, in fact, those two topics you just mentioned. So one, we have I've now a chief data science officer for our supply chain and our broader set of functions under my responsibility in J&J. We're building out one of the top data science organizations, I believe, in any supply chain around the globe. Secondly, our chief sustainability officer for Johnson & Johnson is now a fully dedicated position. That's also part of my team. And to your point, those intersections of ESG, digital, to me, they are a core of how we are all strategically evolving the much bigger impact that supply chains have in the world, not only from an economic view, but from a societal view.
Well, Kathy, it has been such a pleasure talking with you about various trends in global supply chain and how they've accelerated as a result of the pandemic. Because understanding trends and thinking about how they create challenges and opportunities is the key to strategic thinking, your insights have been particularly helpful to those watching for them to be thinking strategically. So thank you so much.
Well, thank you for inviting us. Again, it's great to see you and wonderful to participate here and help continue to stretch that strategic impact of supply chains around the globe. So thank you.